Welcome to Accessible, where we open the door to the people and ideas shaping the disability community. I'm George Gotto.
And I'm Amelia Reighard.
On Accessible, we talk with leaders, advocates, researchers, and individuals with lived experience to explore the issues shaping the disability field.
Accessible is produced in partnership with the Missouri Leadership Education in Neurodevelopmental Disabilities, or LEND, and the Missouri University Center for Excellence in Developmental Disabilities, or UCED for short.
And whether you work in the field, are connected personally to disability, or simply want to better understand how systems can support people with disabilities, Accessible opens the door to conversations that matter. Oh my gosh, that conversation with Libby that we just had was maybe one of the most impactful that I've ever been involved with, certainly on the podcast.
Wow.
I mean, like, well, one of the very first statements that she said was rural Missouri is dying. And that,
that's like,
She started with a bang,
Missouri
for sure.
is three times higher than the birth rate.
She's like, there's no more messing around. We're just getting straight to it.
100%.
Yeah.
Oh my gosh.
Yeah.
And I just talking about disability, that, if you look at all the counties that have a disability rate of 21% or higher are all rural counties.
Yeah, that was shocking. And just shows, the importance of, all of our work in the disability field and how much we need to be paying attention to the rural communities. Because it's feels like we're in a dire situation. I don't mean 100%. To sound so negative, but I feel like I left the conversation being like, all right, we have to go to a strategy room and we need to be like, how are we going to revive rural Missouri? How are we going to help people thrive in these rural communities? And I think it was interesting. We all kind of shared at some point that we all come from small towns, small rural towns, Colorado, Iowa, South Dakota. Producer Catherine, your family's from Arkansas, right? So we all have these, like, our hearts are tied to these rural communities, and totally that they need some TLC or something. Yeah. Just to cut in, we are talking today to Libby Trammell from Missouri Rural Health Association. She's the Community and Digital Advocacy Manager, also the co-author of their most recent needs assessment, which gave us some sobering information about the status of rural Missouri, but also very important that we are aware, because I do think we can kind of be in our bubble of, like, we're in Kansas City, we're thinking of all these, like, urban, more of the urban landscape and the different resources that are available to people here, but just thinking about how access is even harder if you're in a rural area and how some of those problems compound.
Right.
But
sobering, I think, is the right word, is a good word, Catherine, because it really is, like, to take in the information that they collected in their needs assessment and sit with it for a second. It really is. You need to take a minute with it. And I think that she also gave some really great practical steps for how you can, keep a watchful eye on how at least legislative policies and changes are impacting rural communities. And that she kind of encouraged listeners at one point that it might seem overwhelming to keep track of everything that's happening, but that you can track an issue you care about, or a population you care about or a topic you care about, and then follow that closely and get involved and make your voice or your concerns heard. So I felt like that was an encouraging, practical thing, that it is sobering, it is overwhelming, but we don't have to be, like, immobilized by that, right?
Yeah.
This definitely was probably good for me, and it's just making me rethink. You talked about starting to strategize about how are we going to fix healthcare in rural Missouri, but seriously, I do think that this is going to kind of redirect some of the work that I do and some of the work that I think we should do at IHD. So very powerful conversation.
Yeah, totally.
Yeah. And Libby she's an enjoyable guest in that we're talking about really heavy topics, but she's a fun person and she's got a lot of great energy.
All right.
Well, I hope everyone enjoys.
Yeah, enjoy.
Long live rural Missouri.
We are so excited to have Libby Trammell joining us today from the Missouri Rural Health Association to talk a little bit about sort of rural health advocacy and disability. And I think it's going to be a great conversation. So, Libby, welcome to Accessible.
Hi, thank you so much. I'm really excited to be here.
We're excited to have you.
Yeah, I'll just say off the top, I am a rural kid. I live in Kansas City, obviously now, but grew up in a very rural town and farming community. And so have seen and continue to see these issues play out for my parents and other people I know. So very excited to learn from you today. So. So let's just start with you and talk about like how does a social worker from St. Louis get interested in rural health?
Well, actually, I'm not from St. Louis. That's the plot twist here. I live in St. Louis now. I grew up in South Dakota. So the rural issues are very near and dear to my heart. I grew up in South Dakota. I got my undergrad degree there at a school that is pretty well known for its agriculture program. Many of the students are from rural environments. And I came to St. Louis 7 or 8 years ago to earn my master's at WashU. And then I just kind of fell in love with Missouri. So I've stayed here. But I got a master's in social work. I am also a licensed clinical social worker. So that means I jumped through all the hoops and did all the supervision and took the hard tests. And so now I get to have those letters behind my name. But yeah, the rural healthcare has always been really important to me. Before moving into my role that I have now with the Missouri Rural Health Association, I did frontline case management and crisis intervention work, predominantly with people who were experiencing intimate partner violence or domestic violence, and then also people who were experiencing human trafficking. And with all of those topics, I was seeing rural clients really getting left behind. And so it became very clear to me very quickly that this is something and not just on those topics, but in many disparities we see in the rural areas. I think rural communities get left behind a lot, and I would like to do something about that. So,
yeah. Well, can you talk a little bit about the Missouri Rural Health Association? I didn't honestly know that much about it until Amelia started talking about.
Absolutely. So we are a statewide nonprofit. As I said, I'm based in St. Louis, but we have staff across the state. We do many different things. We have a lot of advocacy going on. So we do have a lobbyist in Jeff City. We do legislative advocacy. We also provide education. So Amelia met me because we were doing what we call our lunch and learns. So we have lunch and learns on a variety of rural topics. And so we do community education that way. We also do statewide needs assessments, which I will delve into at length today. I'm the co-author of our 2026 needs assessment. So that's what it sounds like: statewide data gathering, looking at disparities, trying to figure out ways to address these. And then lastly, we house The Causeway, which is a really fantastic online platform entirely made up of rural healthcare workers, advocates, doing everything from case consultation to talking about grants, how do we get funding, even things like medical coding questions, because that can be really complicated. So we got a lot going on, I would say, at MRHA for sure.
Yeah.
That's awesome. What a resource you guys are to the state. And yeah, I did meet Libby on her Lunch and Learn, which I would highly advocate you to follow all of their events. I think after that, I went on your page and saw all of the different Lunch and Learn events and community webinars and things you have. And you guys offer a lot of great education and resources. So, and you are a very engaging facilitator, Libby, which is why I knew you would make a great guest on the podcast. I was like, we got to talk to her because she knows her stuff and she's fun to talk to. So I'm so glad you
It's the theater kid.
Oh my God, Libby, I'm a former theater kid too.
There's the connection.
It's theater, it's social work. Happy Social Work Month, by the way.
Thank you. Thank you so much.
I raised 3 theater kids, so
That's a full-time job in and of itself, I think. I think about all the things my parents shuttled me to, and I'm like, thanks.
Yeah, that's funny. Let's talk a little bit. I mean, we could talk about theater all day, but we'll dive into the needs assessment. I'd love it if you could talk a little bit about what were some of the biggest findings from that needs assessment, or what are the things you're hoping people will pay attention to from your 2026 needs assessment?
Thank you for asking. It's a big passion project for me. And Derek Landis, who is the main author, is really, really talented and has a big passion for this. And I was lucky enough to co-author this with him. So we essentially are seeing, there's not really a way to sugarcoat this. Rural Missouri is dying. We are seeing death rates at 3 times higher than birth rates in rural Missouri. So people are dying 3 times faster than they're being born. Some of that has to do with
shocking to me.
Absolutely. Some of that has to do with families moving away, especially if they can't find, good job opportunities, or they have needs that can't be met in the rural communities. Other times, we are seeing causes of death quite prevalent in rural areas. So when you look at a lot of different causes of death, respiratory infections, cancer, any of these sort of big causes of death, every single rate is higher in rural Missouri than it is in urban. So we are seeing higher cancer rates. We're seeing higher chronic respiratory infections, things like diabetes, asthma. All of these things are higher in rural Missouri. Another thing that I think people really need to pay attention to in this needs assessment, would either of you like to guess? And I guess Amelia was in my training, but what do you think the leading cause of death for Missourians 18 to 44 is?
I know it, but George, maybe you should guess because I went to the
18 to 44. Cancer?
That's a great guess, and a lot of people guess that. It's actually overdose. I
was going to say that, and I thought, surely no.
I know, we wish it wasn't true, right? But we're seeing overdose being incredibly prevalent in Missouri. Something to consider sort of around that as well, that our needs assessment found was death rates are very present, and we're seeing less visits to the ER for overdose. So there's a few thoughts behind that, possibly because we've seen so many rural hospitals close. Folks aren't able to make it to an ER when an overdose is happening. Other sort of thoughts around this, and again, we can't be totally positive why this is, but with things like Narcan, other tools you can use to address an overdose in the home, folks might not be going to the doctor and instead relying on those methods. So the overdose piece, I think, is really important to pay attention to.
I just want to clarify, that is such a stunning thing that you said. I want to make sure I understood. Death rates in rural Missouri are 3 times higher than birth rates. Is that
You heard that correctly? Yeah. So if you visit our needs assessment, and we'll talk about how to find that, you'll see we have it placed out with graphs. So the visual data is even more stark. To kind of see it all plotted out is pretty wild. So that is something that we hit and wrote about a lot, just as obviously, George, you said you're from a rural area. I have a lot of love for rural areas. But I think another sort of just black and white truth is, if rural communities go away, everyone should care about this, because where do you think your food is being grown? And where do you think your energy is coming from? Certainly, I think people should care just in general, because rural communities are important. But this will become everybody's problem fairly quickly if we can't figure out a way to address this. So yeah, I also could talk a bit, if you'd like, about some of the disability stats that we found, because I know obviously that's what we're talking about here, right? So what we found is in Missouri, any county that has a higher disability rate than 21% um, was all rural. So all 27 Missouri counties with a disability rate of 21% or higher are rural. So what that probably denotes then is that we are seeing more disabilities in our rural communities than in our urban, just on like a percentage population level. We also found in rural Missouri specifically, children with disabilities are experiencing more frequent ER visits and longer hospital stays than their urban counterparts. So rural children with disabilities are going to the hospital more and staying at the hospital longer than urban children.
Wow.
Mhm.
I mean, we can only guess exactly for the causes for that, but I'm just wondering if you don't have access to that regular or even preventive medical care or supports at home, that you're getting into these emergency healthcare situations. You're really responding to crises as opposed to maintaining or preventing health conditions for kids with special healthcare needs already or with disabilities.
Absolutely. That is a big factor for sure. If you can't make those upkeep appointments, which, if it's a 3-hour round trip and I have a full-time job and I don't know, 4 kids, that's a tough ask. So people are really struggling to make it to those upkeep appointments. And that does link, I think it's pretty clear that that links to other things like cancer deaths, because especially if you're not catching it early on, through those, things like mammograms, colonoscopies, your cancer can progress further and become a more serious issue. So when we're talking about disabilities that require those upkeep appointments to stay kind of at your baseline, it can get really tough for sure.
Right. Yeah. One of the things that one of our teams here, our health and aging team here at the USED has been working on the last few years. It's a project that was funded by CDC, but was to sort of pilot this idea of like a we call them linkage coordinators, but really like a health resource navigator for people with intellectual and developmental disabilities, to say, what to do, kind of a screening of like, what preventive healthcare are you already engaging in? And if not, then how can we connect you to that resource? But one of the hardest things that we found in that pilot is just that people are facing a lot of other crises, right? Like food insecurity, housing instability, unemployment. There's other things that they're facing that is a higher priority than I need to make it to my 6-month oral health checkup, or I need to get a primary care physician. And so a lot of our linkage coordinators ended up kind of helping them navigate multiple things at once. Well, let's get you enrolled in health insurance. Let's make sure you have, a food source, and then let's try to get you connected with it. So it was a lot of navigation and kind of coalescing a bunch of resources in order to meet a health need. So anyways, just interesting. I guess it kind of just showed the difficulty people have navigating multiple systems and dealing with multiple crises at a time.
Absolutely. I think the experiences of trauma and how it affects our sort of executive function is important to consider. So, yeah, if I'm having the worst day of my life and I'm hungry, I don't know where I'm going to sleep tonight, I'm not thinking about if I can go get my insulin today. Like I'm thinking about this immediate need. And so, yeah, those linkage coordinators are really vital. And I think folks sometimes underestimate as well, especially if someone's experiencing homelessness. It can be really tough to plan ahead when you don't even know what's going to happen tomorrow, right? So we definitely see a lot of those drawbacks. And in my time as a case manager, we have to focus on these immediate needs because otherwise nothing's going to get done. Yeah.
Wow. This is seriously, I feel like I'm connected to a lot of what's happening, particularly in the disability community, and this is just blowing my mind. Can you talk a little bit about, I guess, where do people in these rural communities, where are they getting their health care? Are there hospitals? Is there a shortage of doctors?
Great questions. So our rural communities get served through a few different ways. We have, of course, rural hospitals. We have what are called critical access hospitals. Um, and then we also have rural health clinics and what are frequently called FQHCs, which are federally qualified health centers. So all of these things exist in rural Missouri. And we have seen a lot of closures happen in the past, probably 5 to 10 years. We've seen a lot of closures happen. The nice thing, if you will, about things like FQHCs is they are designed to house a ton of services in one place. So, right, like ideally they would have, you could get your OB services, your dental care, your primary care, all of that in one building, which is awesome. So big shout out to FQHCs. And we don't have enough of them. A lot of folks are struggling to get transportation. But George, you touched on another issue we're seeing, which is definitely the workforce piece. So we are seeing a steady decline in interest for people to work in rural spaces that are healthcare providers. So that can mean anything from like MDs to nurse practitioners to dentists to dental hygienists. Like across the board, we are seeing a decline in interest. So that is something that we are definitely looking to address, and a lot of universities in Missouri are trying to address as well. So if anyone would like to know more about that, I highly suggest you Google the Rural Scholars Program. We have a very cool Rural Scholars Program that addresses this and offers incentives and education for students that are interested in working in rural spaces.
Yeah. So we keep hearing about, this new rural health transformation project happening around the state. Is that underway? And do you know, or are you able to talk about that at all? It seems like you would be the most important group to be involved in that.
Absolutely. Okay, so I don't know how fast of a turnaround you get these out. Today is St. Patrick's Day. So as of right now, we are still waiting to find out who will be the director of that program here in Missouri. So once that person is appointed, we will have a lot more information about what's going to happen next. If you're listening and you're like, what is this transformation project? This is money that was set aside in the One Big Beautiful Bill Act that is aimed at rural health. It was federal, and every state applied for it individually. And so how those monies were awarded to each state was a federal process. And now we are in the throes of figuring out how that will be sort of dispersed here in Missouri. So I don't have a ton of updates on that. We are anxiously waiting to see what that's going to look like moving forward, because it could look many different ways. So I think right now we're all a little anxious and just sort of pacing and waiting to see what happens. Yeah.
Yeah.
And your needs assessment is so timely in highlighting, here's all of the things that we're noticing in the rural health landscape. So then, how do all of the entities and organizations within Missouri, the state agencies, the community-based organizations, healthcare providers come together to really address these needs and make sure that people don't get left behind, right? Rural communities and, different populations within those rural communities, people with disabilities, that sort of thing. Yeah, one thing that I thought was really interesting, Libby, in your presentation on the needs assessment is because we just talked about hospitals and FQHCs and what's available in these rural communities, but you guys even were able to look at projections of hospital closings in Missouri in the next, was it like over the next decade, that there might be some additional hospital closures, and I don't know if that's something you can project based off of like upcoming changes to Medicaid or kind of how those are made, but we're seeing that potentially more hospitals could close. Am I understanding that right from your presentation?
Correct. The factors that are present to cause a hospital to close have not been alleviated. And those factors look like funding, reimbursement. Is the community able to, sustain the hospital? The challenge when we're talking about hospitals closing as well is it's not just that the services go away, but hospitals are huge job providers for lots of people, not just doctors, right? But you've got like cafeteria workers, housekeeping staff, like even I in high school, I had friends that had part-time jobs at hospitals. I mean, they're big job providers. And so when they go away, it crashes quite a bit of a community's infrastructure. What you're speaking to in our needs assessment, it does project. We borrowed that research, and I should know their name off the top of my head, but you can look in our work cited there at the bottom. And that was some researchers that were essentially analyzing what factors are most prevalent where. So yeah, this has not gone away as a risk for sure. And I know you touched on the Medicaid piece, and I'm happy to talk about that more now if you all would like to hear a little bit. When we talk about Medicaid, I think there's a lot of misinformation and maybe a lot of fear around what is actually happening. And so to talk just a little bit about what we're looking at. And again, so I did frontline case management. I helped people sign up for Medicaid. It's a super lengthy process. And so I'm going to talk a little bit about the proposed changes and how that might impact rural folks. So when we are looking at, one of the things I want to touch on is the proposed changes that are they're called work requirements. So right now, the proposed changes that are set to begin, it's January 1st of 2027. So we are now less than a year out from that. Any adult 19 to 64 must demonstrate at least 80 hours of work or community service per month or enrollment in an education program at least half time. I think a lot of listeners might hear 80 hours a month and think that's not that big a lift. That's 20 hours a week. That doesn't seem like a lot. The challenge around this, in this is a Libby opinion as a case manager, is that many times finding an opportunity that is accessible for you if you have a disability is going to be hard. And then consistency can be challenging as well. So I have a chronic pain condition. That's a pretty common disability. So some days, like today, I can get up and do things and I'm good and I can walk around and that's great. And then I have other days where I'm in a lot of pain and doing things and showing up is harder for me. So if I'm someone where I have this volunteer opportunity, but I'm experiencing a few really heavy pain days, so I can't hit my hours threshold, this creates a lot of issues for me to hit that 80 hours a week. Yeah. And there are exceptions to this. So I read a few of them, but there's also language in this that says if you are pregnant or postpartum, if you have children of a certain age, if you're in rehab, there's a few other folks can Google the whole list of them. There are some exceptions. However, this does project to be pretty prohibitive, especially for rural folks. So for our rural folks, we are seeing that Missouri is expected to face a 21.1 billion reduction in federal Medicaid funding over the next 10 years, and that could get substantially worse over time. So we could lose nearly a fifth of our federal Medicaid funding, which is big for infrastructure, big for services. Another piece of this to consider is when we're talking about rural as well. So I'm sorry, I'm going to return to the work requirements piece real fast. So um, there is a possibility here for people to have to what is called redetermine their eligibility. So if I am receiving Medicaid and I do my 80 hours and I'm sending those to my caseworker or whoever is in the oversight of that, I might have to continue to prove my eligibility, and I might also have to renew my eligibility, possibly every 6 months. So what that can look like is every 6 months, I need to possibly go in person. I need to possibly make time during the day. Again, if we're talking about people receiving Medicaid, these are often people with disabilities where transportation is a challenge, making appointments is a challenge. I spoke earlier, I worked with people with some really heavy trauma. And one of the biggest factors, one of the biggest symptoms when you're living with heavy trauma is struggles tracking time and struggles tracking what day it is. If you're in survival mode, you're not going to remember your appointment in a month because you're too busy trying to survive this minute right now. And so again, I think people might hear, oh, every 6 months, that's not so hard. But I think folks really need to be mindful of that is hard. That is hard for a lot of people. And anyone out there who's listening, who's done case management work knows that, making it to appointments is a big struggle. And heck, even if you don't have a disability and heavy trauma, I'm sure we've all ghosted an appointment or two. But the challenge here, is that it could cost someone their Medicaid. So.
Yeah, that's interesting. When you're talking about like renewing eligibility, you're talking about like being able to prove again your status as a person with a disability who needs.
Yeah. So it can look like that. Other times it can just look like submitting your hours. This is new for us as well. So these like are projected changes. So some of that nitty gritty is still a little ambiguous. The Medicaid application process in general is quite lengthy. You need to get a lot of documentation together. You often need to have a lot of documentation from your healthcare providers. And so this may also create a burden for healthcare workers because now there's more paperwork and more sort of re-upping of everything. So
Yeah. What does this look like, I guess, for MRHA and legislative advocacy? I mean, when you guys are bringing this information to Missouri's legislature, are they worried about these things? Are they seeing the projections up and the impact it might have on rural communities? And is it giving them pause, or how does this landing with the legislature, I guess?
great questions. I think it's pretty, so at our MRHA, we have three legislative we call it our policy agenda. So we have three things that we are like hyper focused on that are definitely connected to this Medicaid conversation. And the first one is investing in rural health infrastructure. So we're talking about like keeping those hospitals open and accessible, making sure that there's critical care happening. So that's the first one, which is obviously impacted by Medicaid. Our second one is reducing rural healthcare workforce shortages. Super important. We touched a little bit on that. And then the last one is addressing rural declining life expectancy and access to care. So when we talk about that, because I know I touched on loss of life, but life expectancy as well, we're seeing be pretty stark in these rural spaces. And so when we talk about Medicaid and we talk about life expectancy, Medicaid, many people that use it, these are the folks that get left behind in so many of their needs, and their life expectancy plummets as a result. There's tons of studies that show us that things like stress can lower your life expectancy. And I could talk for days about generational trauma and racial disparities in that. But to answer, sorry, Amelia, I was going on a rant, which is what I do. But so all of that to say that Heidi, our executive director, who is in Jeff City often, is very hyper aware of how these things are impacting our rural spaces and is definitely advocating hard. In terms of how lawmakers are receiving that, it kind of depends. I mean, we have a lot of really stellar lawmakers in Missouri who are from rural areas and see the danger that is happening here. And so I think some of it too is about kind of showing the reality. Because again, I think people hear work requirements and they may think like that makes sense. Someone should have to show up if they're receiving this care. And I could understand why someone would feel that way. But I think maybe they aren't as familiar with the actual reality. Like what it sounds like and what it actually looks like are two very different things. Yeah.
Yeah. It's bringing me back to this conversation, George, you and I had recently. And so, sorry, I guess I'm going to steal something you told me about and make it my own here. But we were talking about this group called the Frameworks Institute. You were telling me about, George, and they were talking about how you I guess I don't want to say convince or persuade, right? But how you talk about certain ideas with people who may be coming from a different perspective, right? And you start with this conversation about values. And so like, what do we value and how do we align on what we value? And then you can get to the so what, how, what part of it. And so, Libby, just thinking back to your comment about we need to value, and we do value our rural communities, right? Like rural communities matter. They matter to urban communities because they're a food source, right? They matter because a lot of us, I think all of us on this call come from a rural area in the Midwest, right? I'm from a small town in Iowa originally. So that kind of finding that values alignment, I'm like, how are we going to take care of and address the needs of our rural communities? And then getting into how are they impacted by what's going on maybe currently through legislation that's been passed or just what's going on in the communities with drug overdoses, right? These sorts of things. So then how can we work together to address them and find alignment despite maybe our different perspectives because our value is taking care of the rural community.
Absolutely. Something I'll say too. So I'm also an adjunct at SLU. So I teach a couple courses there, and a lot of students come in feeling really overwhelmed by the legislative process. Like I think we all watched the Schoolhouse Rock, like on just a bill. And then I think like that was some of the only education that we received, or like we didn't keep learning, right? And so folks feel like this is a big, scary mystery of a process. And I understand that completely. It's very intimidating. Something that any listener can do that I think helps a lot is if you hop onto the Missouri House or Senate website, they have different committees that are focused on different topics. So, like Health and Human Services, you can follow just a committee and see what bills they're talking about. And in that way, you can just pick a committee that covers topics you care about. Maybe you really care about children, follow one. And so that's just like, and it's a smaller bite size thing rather than trying to keep track of every bill. MRHA, we also have a legislative or a bill tracker on our website. So if folks want to like pull that up, you can look at like what bills we are watching as well. So I wouldn't underestimate that as a choice, because I think a lot of lawmakers want to hear more from constituents, especially about these rural pieces. But we just don't see people reaching out as often. So
I love that advice. I think that it can be overwhelming to look at everything and say, I don't even know where to start. I'm a little murky on the process. I don't want to put my foot in my mouth and say the wrong thing even. So where do I start? But just even following one committee that kind of aligns with maybe your professional hat that you wear or just an issue you care about. And then using your voice to weigh in when you're like, oh, actually, I do have something to say on this. Or, Libby, you've given just even examples today of like when I was working one-on-one with somebody, this is how this policy or this practice impacted them. And to be able to share that, it makes it really tangible and less overwhelming. So I think that's great advice.
And I'll just go back. I've said this before on the podcast, and so Amelia's probably heard this. She's tired of it. But one of the things that has happened is that for me in the last year is as we've had to, advocate more, I have been so pleasantly surprised to learn how accessible our legislators are, both state and federal. I've just kind of always been in my work focusing on that, not thinking about policy advocacy and just felt like, oh, that's just something that goes over there and I can't really reach it or touch it or be involved in it. And I've just learned this year, which has been great, that no, people do want to, our legislators do want to hear from us, and they are there, and the system is such that we can communicate with them and their offices pretty easily.
absolutely. And I think folks get a little worried. Like, I like that what you said, George, because it is more accessible than folks estimate it will be. And then Amelia, you were like, people are scared to put their foot in their mouth. You do not need to have a master's in political science to like, I email my legislators are probably tired of me because I email them a lot, but you can email them and it doesn't need to be like this perfectly written 4-page long thing. It can be as simple as I live here. This is my background and this is why I think you should vote this way. And that can make a difference for sure. So yeah. A good first step that'll take you 30 seconds if you're listening is find out who your legislators are. It's really easy. You're gonna Google Missouri legislator, look up, throw your address in there, and it'll tell you. So
that's awesome. I want to talk about something else that you're really involved in at MRHA, which is a great resource, I think, for people to know about that I just have learned about in the last 6 months through interacting with MRHA is the Causeway. So can you tell us what the Causeway is and why it would be a great resource for people to know about?
absolutely, the Causeway is fantastic. So I won't lie, the Causeway is my baby, so I could talk about it all day. But it is an online platform. People hear that and I think are like, am I going to get a million emails about things I don't care about? And that is not what it's for. It is free and open to any healthcare worker, an advocate, or student. And we do lots of different things on there. So there are lively discussions happening about my favorite post that happened, I think last month, was someone asked, I work in a rural center that has a daycare, a senior center, and a health clinic in it. Can I legally put Narcan out in the hallways? Will that violate a grant? And it was one of those like rural things because we cram as many services as we can into one building. But it was like, that person can't Google that. That's like too many factors, right? And they got answers from professionals with tons of experience who had like linked the laws and were like, you're good to go. Here's the laws. It was such a good example of a very specific problem that the computer can't tell you the answer to. And so the Causeway is there for those collaborative moments for sure. We also have a ton of resource listings. So this month is many things. It is Social Worker Month. Thanks, Amelia. But it's also sleep hygiene month. It's which I think is interesting. So going up here in a week, we will have a blog post with a ton of listings for rural resources for sleep studies. Because things like sleep apnea, if it goes untreated, can take up to 10 years off your life. So having access to sleep studies is really important for lifespan. So that's one example, but we have many resource listings. We do resource highlights as well. So we will pick different services around the state, interview them, kind of lay out what their different options are. We have those pieces in the Causeway. It's also just a really strong networking tool. So I had someone post, they were looking for rural health clinics that were all along the western border of Missouri. And they were like, I'm just needing some people. I have a free medicine program. I want to give out some medicine. Help me find people. And right away, we were able to look at the people in the Causeway and be like, these 15 professionals all work in rural healthcare clinics. So like on that western border. So here they are. And then that original poster, could just message them and be like, I have free medicine. Do you want it? And so what we were finding with that needs assessment, so I've talked a lot about the data, but we also did interviews with professionals and folks that have been in this for a while. And one of the biggest things we kept hearing was like, I'm so siloed. Like, I know what's going on in my county, but I'm kind of alone. And so the Causeway was our answer to that. Something that my colleague Derek says a lot is like, I don't know how to cure cancer, but I do know how to get people in the room that might have a good conversation that can figure out how to cure cancer or can figure out how to get cancer screenings in these communities. So the sort of idea behind this has always been, if we can build the spaces for the people who are smart about this to sit in the same room together, virtually, physically, whatever, then we can find some of these answers. So
it's like creating that bridging capital, bridging social capital
yes,
for folks.
absolutely. Yeah.
That was exactly the thought I was having, Libby, as you were speaking, as I was thinking about the conversation earlier about the declining workforce, like that, there's not enough healthcare providers and professionals in these rural communities. And I was like, I wonder, there's just so much loneliness in being maybe like a singular provider in a rural community. Like what colleagues can you collaborate with, workshop challenges with, and solutions? And sounds like the Causeway is like a really good space to give people a community, even if they're practicing kind of solo in a small town in rural Missouri, right? So it sounds like just a really timely and needed resource.
Thank you. I'm a big fan. But yeah, again, it's free and open to anyone who is working in rural healthcare. So truly, anyone can join us if, and I know we'll probably plug how to access everything later on in the show, but it's just MRH and then the word association .org or MRH, and then the word association.org. So you can find us there, and it's I love it. The Causeway is very helpful. So yeah.
It is pretty amazing. I've been exploring it. So I did notice while I was on and exploring the Causeway that there is a Missouri Rural Health Conference coming up in 5 or 6 months. Can you talk about that and can anybody come to that? Is that something you
Yes, thank you for asking.
Huh?
Yes, anyone can come to that. So we have our Missouri Rural Health Conference is September 9th and 10th. It's going to be, we're up in the Ozarks area, and it will, so this is, I don't know how many years we've been doing this conference. I should know, but let's pretend that I had the number in my head. But so we are lucky enough, we have presenters from tons of different facets of healthcare. Last year, I presented on the Causeway to show folks how to use it. So, but we had people presenting on everything from one of the most well-attended ones that I also attended was on getting reimbursements when your patients are coming in with Medicaid, because that's like a constant battle, the coding and the reimbursement of it all. But we also there was a lot of talk, of course, of the rural health transformation project. So yeah, there will be tons of different topics. Anyone in rural healthcare or anyone in general is welcome to attend, and you can find that on our website. Yeah. You can also, I know, Amelia, you touched on our lunch and learns. We have those almost every week, give or take, and those are on Thursdays from noon to 1. We record all of them as well. So if you can't make it and you shoot me a message or however you want to get in contact, I can give you the whole library. So many trainings. So yeah.
Well, we're lucky to have you guys in Missouri. I think you guys have so many great resources for healthcare providers in rural areas, and we're excited to continue to follow your work. I mean, I'm excited to continue to follow your work and see how we can collaborate.
Yeah. Well, thank you. We're lucky to have had you on our podcast. So thank you, Libby, for sharing all of this. I mean, it's just been eye-opening for me, and I'm sure it will be for our listeners.
Absolutely. And I am not shy about people reaching out to me. You can email me if you want. My email is ltrammell, Trammell @morha.org. So that's me. I'm Libby. And I'm happy to answer any questions if folks want. And I could talk about our 91-page needs assessment all day long. So if you like to read heavy documents, hit me up because we can talk. Yeah.
I'm definitely going to get into that. So thank you.
We have the executive summary. There's a shorter one too if you don't want to read the 91 pages. Yes. Yeah.
That's awesome. Well, we're sort of research heads over here that you said, so I'm sure
love it.
The 91 pages will be fully digested.
Yeah. Thank you both. This was fantastic. I think disability justice work and disability access are some of the most important conversations and so much more expansive than people understand. Like, I think people hear accessibility and are like, it's wheelchair ramps. And I'm like, yeah and it's a million billion other things.
Yeah.
Right. So yeah, I think what you do is so important and vital. Yeah. Thank you so much for inviting me.
Yeah, thank you.
Our pleasure.
Yeah.
Thank you for listening to this episode of Accessible. Accessible is hosted and produced by George Gotto, Amelia Reighard, and Catherine Toller from the University of Missouri, Kansas City Institute for Human Development, which is the home of the Missouri USED. Accessible is a joint project between the Missouri USED and the Missouri LEND program, which is funded by the Health Resources and Services Administration of the U.S. Department of Health and Human Services through grant number T73MC00022. Episodes of Accessible are released every 2 weeks and can be found wherever you subscribe to your podcasts. Join us next time to hear more insights and ideas from leaders in the disability world.